Each year, as you know, we select a small number of heroes of our reform movement and give them an award and recognition which they richly deserve. And we are doing it again. However, I do want to take a moment to make a personal remark, since we are a organization that is nonpartisan, but we're also aware of what's happening in our country. We are, at least in my mind, the worst president in the history of the United States. Even more important to all of us in the health reform movement is he is the threat to everything we've spent so many years painfully building up to take care of the health needs of the American people. And his efforts are, of course, to destroy them all one by one, starting with the Affordable Care Act. And we are the ones who are playing an important role in that struggle. And I want to commend everybody, which is probably most of us, who are doing what they can to protect what we have and build on it. Now, as to the purpose of this award session, as many of you know, Families USA has divided its work into 4 very important areas. Healthcare value, you just heard something about it. Health equity, coverage, and consumer experience. And we will give an awardee in each category at this time. So, as is our custom, I will have a chance to inviting an introducer who will then talk to us about each of the 4 heroes of our movement. So, Justin, if you'll come up, and we will be proceeding with our first award, which of course is in the area of health care values. Exactly.
All right, good afternoon, everyone. All right, is everyone awake? Yes? All right. So I am honored and excited to introduce this year's award recipient for the Consumer Health Advocate of the Year for Value, Stacey Pogue of the Center for Public Policy Priorities in Texas. Let's give it up for Stacey. All right. So when submitting nominations for this year's award, I'm pretty sure the entire state of Texas got together to throw Stacey's hat in the ring, and for good reason. So Stacey has fought tirelessly for nearly a decade to protect consumers from abuses in the healthcare system. Not only have her efforts culminated into real and meaningful wins in Texas, her work has also informed and helped move the national dialogue on surprise billing forward. Stacey's ability to negotiate between health plans and medical providers has been essential to helping consumers get high-quality, affordable health care. Since 2009, she has been considered the leading research and advocacy voice in her state on combating surprise medical bills. In fact, her hard work, tenacity, and exemplary advocacy was integral in Texas passing one of the nation's strongest protections against surprise medical bills in 2019, and she's still continuing the fight to ensure implementation of the law works for consumers. Stacey's work doesn't end there, though. She's also a staunch advocate for women's health and is helping lead the way to expand health coverage for women who have lost access to the system. She's been selected to serve as a consumer representative to the National Association of Insurance Commissioners twice, and she is on the Texas Women's Healthcare Coalition Steering Committee. When asked to describe her, Stacey's colleagues have said she is the most effective advocate in Texas for individuals in the marketplace, one of the most powerful advocates for high-quality, affordable health care coverage in Texas, one of the leading consumer health advocates in Texas, a true champion for health care coverage, and frankly, one of the smartest people they have ever met. Stacey has never given up the fight to ensure that Texans have the care they deserve, and the passion and dedication that she brings to her work has transformed the lives of millions. Texans are incredibly lucky to have Stacey advocating on their behalf. For her leadership, knowledge, and partnership in healthcare value, it is with great honor and gratitude that I present Stacey Pogue with the Consumer Health Advocate of the Year Award for Value. Everyone, please join me in congratulating Stacey.
The pace of healthcare advocacy in Texas, to me, often feels really slow and sometimes glacial. And I think it would be largely intolerable, but for the fact that I get to work with amazing colleagues, Ann Dunkelberg and Melissa McChesney and the other folks at CPPP who are generous and brilliant and inspiring. And then also everybody in this room who's fighting these same fights in their states. But I especially want to say that I'm grateful for all of our national partners where we get this incredible support and incredible technical assistance and camaraderie from Families USA, thank you, and Community Catalyst and Georgetown and Center on Budget and Tim Jost. I don't get to come here every year, but one of the years I was here was in 2010. Right when the Affordable Care Act was passing. One version had been through the House and one through the Senate, and it hadn't quite gotten over the finish line. But it was such a thrilling time to be here. And then that year, everybody in the room, we all won the Healthcare Advocate of the Year award and got posters that had pictures of people fighting to pass the ACA all across the country. And I love that poster, and it's hanging on the door of my office and has been ever since I got an office that had a door. And I hope that we're on the precipice now of doing that again, doing another big push all together with all of us across 50 states to get leaps and bounds beyond where the Affordable Care Act got us so we can finally get, affordable health care for all of us. Thanks.
Our second awardee, with the emphasis on health equity, will be presented by Denise Sanchez, our policy analyst at Families USA. And you'll be interested in the interesting work that she's been doing in an area that has been long neglected. So Denise? Deathless introduction.
Thank you. Hi, everyone. The Health Advocate of the Year Award in Health Equity recognizes extraordinary leadership and contribution to advancing health equity at the state or national level. We all know that achieving health equity is dependent on community-based work as it is on political, economic, and systems-based efforts, advocacy, and change. Considering this, the role of community health centers in making healthcare accessible, affordable, as well as trustworthy for medically underserved populations is indisputably significant to advancing health equity. This year's health equity leader comes from Arizona and who, by all accounts, works fearlessly and tirelessly to truly put community in community health center and put community as the center of his work. Walter Murillo, a member of the Choctaw Nation of Oklahoma, has overseen the expansion of health and community services as the CEO of Native Health of Phoenix for the past decade. Under his leadership, Native Health has grown from 1 center to 4 across to provide integrated, patient-centered, and holistic care to over 10,000 American Indian community members, as well as thousands more in the metropolitan Phoenix area. He has made Native Health a one-stop shop by increasing the number of social services addressing the social determinants of health to an incredible 39 programs. These include a medical legal partnership, employment training for individuals re-entering society, a mobile pediatric dental clinic, an American Indian housing directory, community and traditional gardens, and a food pantry and distribution to address food insecurity, a program delivering meals to over 50,000 people annually. In addition to serving as CEO of Native Health, he serves as the president-elect of the National Council of Urban Indian Health. In this role, he travels across the country to call attention to the unique challenges faced by urban Indian health organizations and the urban American Indian and Alaska communities they serve. In fact, he was instrumental in securing the largest budget increase for urban Indian health in the federal budget this year. Walter's accomplishments demonstrate not only his dedication to community, but his unwavering commitment to health equity. It is clear why his peers and colleagues universally call him a healthcare pioneer. As someone who started her career in health advocacy at a community health center, implementing the types of programs Walter has championed and continues to champion, it is my honor to present this year's Advocate Award in Health Equity to Walter Murillo. Please help me welcome him to the stage.
Well, thank you. I want to thank Families USA for honoring me with this award this year in health equity and an advocate in health equity. And I really have to say that I stand up here not by myself, but with others and with a great community. And that begins at home. I think when we think about health and we think about health equity, that means equity and access for all. I want to start by thanking my wife, who made this trip with me to Washington this time. She's over here at this table. I'm not sure there's any bigger price to pay than working in public health than the price that your family pays, because you become so committed to making change and so happy when change happens, but it's not overnight. It's overnight, maybe overnight working and leaving them, by themselves and missing important events, but I'm very happy for the support that I get at home from my family. I'm also very happy to lead the organization and full of members of the community that are really, really at their heart dedicated to the mission of service, dedicated to the mission of service of the community. We had for a long time served only American Indians and Alaska Natives within the city of Phoenix, but about 10 years ago became a community health center funded grantee, and we're able to leverage the lessons we learned as a deeply underfunded urban Indian health program to expand that to other members of the community. And by then, we realized that our community was growing anyway. Families get blended, families have access. Our communities have different reasons for wanting to seek our service, but I think the primary reason is that they're comfortable there. American Indians and Alaska Natives have many options in Phoenix, but where they go where they're comfortable. So we find ourselves hosting folks that live as far away as 30 and 50 miles, and so transportation becomes an issue. And how do you address that? And then we do patient surveys, and we find that underlying a lot of what we do is domestic violence and substance abuse issues, and how do you address that? And then people are hungry, and then how do you address that? Over and over and over again, we find these issues as we become more involved with our patients, more involved with our community. And what I'm happy to say is that, as I said, I'm not standing up here alone. I'm standing up here with people that understand what our communities are going through, and then make a real effort in trying to change that and make a difference. So while I can stand up here and say we have 96 different programs and that we serve all these folks, you know, we don't do it alone. And we do it with collaborators as well, with the NCUI, National Council for Urban Indian Health, with the federal government, the USDA. Our center, and I'm proud to say, was the first center to pilot a project with the USDA in which we expanded our summer meals program into a year-round meals program for our patients, because not just the kids were hungry in the summer when school was closed, but the families were hungry as well. And so recognizing this and working with the USDA, giving them tours, they came through with this grant, and now I know it's expanded across the country, and it's worked very, very well for our families. And as Denise said, we're served over 50,000 meals annually. I'm also thankful to our funders, and most especially to our board of directors. It is a community-based board that is mostly comprised of American Indians, Alaska Natives. That's the majority on our board. But they understand the unique obligation of the organization to allow me to come to Washington to lobby, to allow me to leave my office and go down to the state and talk to state legislators and department heads about what they can be doing. And believe it or not, even living in a very conservative state like Arizona, when you talk to individuals one-on-one, they really become interested in helping to the full extent that they can. What I have found out, that no matter how you are on the political spectrum, everybody wants to help their neighbors and everybody wants to help their friends. And when you categorize it as that, you really end up with a successful organization, and I'm glad to lead that organization. And so thank you once again for the award.
And now to our third awardee, having to do with the issue of coverage as we strive to move to universal coverage and work very hard on it. So Cheryl Fish-Partman will make the award. She's our Director of Access Initiative at Families and a long-term member of Families.
Well, thanks. I'm really honored to be able to present the Health Advocate of the Year Award in coverage to Tim Stoltzfus Jost, Emeritus Professor of Law at Washington and Lee University, author, NAIC consumer representative, and tireless advocate for coverage. Families USA believes that a critical aspect of good health for all families is the ability to obtain comprehensive and affordable health insurance coverage. Tim Jost has spent what seems like every working hour working towards that goal for many years. Tim has authored or co-authored books about health law, healthcare coverage determinations, bioethics, healthcare financing, and healthcare quality. Though he was writing about healthcare long before that, many of us first encountered Tim through his health affairs blogs. We relied on his articles to keep us apprised of the status of the Affordable Care Act from the time it was a bill in Congress through the last 10 years of rulemaking and court cases. In fact, Health Affairs includes a Tim Jost reading list of the top 15 of his more than 600 health affairs blogs. Besides being a trusted author, Tim is a devoted advocate and steadfast friend to all of us in the health policy community. And so lots of us wanted to contribute to these remarks. He analyzes proposed regulations as soon as they are out, or as my colleague Claire McAndrew puts it, thanks for burning the late night oil to tell us what exactly is in this thing released in the darkness of night. Even when we too have stayed up late at night to read a newly breaking regulation, we check Tim's analysis, which always helps us see a new aspect or a bigger framework. Speaking, I'm sure, for many of you, one state advocate says simply, "We revere Tim Jost." The words that keep going through my head are, love is patient, love is kind, love is humble. Because all of us who have had the pleasure to be on conference calls and in meetings with Tim feel the depth of his character. He patiently explains his thoughts, though as he should be, he is impatient with bad policy. He makes personal connections to each and every one of us and to the officials he works to persuade. He is unassuming and wonderful to work with. He amazingly keeps going with the work, even when he is fighting his own battle for health. Joanne Volk writes, watching him in action as a consumer representative to the National Association of Insurance Commissioners, I always thought he found the most gentle, informative, gracious, polite, disarming, and subtle way to say, "You are wrong," to a regulator who was arguing that his or her hands were tied. And Lynn Quincy writes, I can think of no other individual who single-handedly did so much to make the world a better place for consumers. As to love, there's a Tim Jost fan club that posts things like this on Valentine's Day on Twitter. You need an AV calculator to measure my love for Tim Jost. As for what to say, and finally, another hero to many of us, Karen Politz at the Kaiser Family Foundation writes, as for what to say, words fail me, which is funny when you think of how well and seemingly effortlessly Tim has put into clear and compelling words the most complex rules and concepts of health reform. Tim makes the Energizer Bunny look lazy. He has turned out reg summaries, rule comments, testimony, and amicus briefs while vacationing on the beach, from a hospital bed, and it is rumored during his son's wedding. Tim has been the nation's health law professor, compiling an encyclopedic reference for all things ACA and teaching us what it means for real people, and he has been a tireless and most effective advocate. Today, 10 years after an enactment of the ACA, there is literally an army of consumer and patient advocates whom Tim trained and inspired. Talk about empowerment. He is a man of wisdom and grace and warm friendship. So thank you, Tim, from all of us who are delighted to be your friends and fans and students and colleagues.
Thank you very much, Cheryl, and thank you to Families USA for naming me your USA Health Coverage Health Advocate of the Year. This is indeed a great honor. I have the deepest respect and appreciation for families and have enjoyed working with families over the years toward the adoption and through the implementation of and now the defense of the Affordable Care Act. I have many friends at families, including Cheryl, Elliot, Stan, Jane, and of course, former families members, Claire McAndrew and Ron Pollock. I accept this award as a Lifetime Achievement Award. As some of you know, I've been missing in action for much of this year as I was hospitalized for 13 weeks for chemotherapy last winter and spring and have since been recovering from a stem cell transplant for leukemia. I've tried to keep up healthcare advocacy work this last year as strength is permitted, including working on healthcare litigation briefs, reviewing drafts, occasionally talking to media, blogging at the Commonwealth Fund, writing a few articles, and participating in conference calls. But I had already pulled back from my work at Health Affairs, which Cheryl has talked about, and at NAIC, as my energy has diminished in recent years. I'm glad to still be engaged, however, and would commend to you retirement as resistance. I retired from teaching and from academic publication 4 years ago. Since then, I have enjoyed the luxury of being able to do whatever needed to be done to protect healthcare consumers, which at this time means primarily active resistance to continued efforts at the federal and state level to sabotage the Affordable Care Act. You are fortunate to be paid to do this, but I encourage you to look forward to someday being able to continue advocacy whenever and wherever you see the need answerable only to healthcare consumers. In conclusion, I'd like to thank my wife, Ruth, who has supported me through all of these late night hours and the work I've done, and also Katie Keith, who has taken over the blog and is maintaining the standards that I tried to set for it, including blogging for the last 2 weeks from the Australian outback. So, and thank you once again. Godspeed.
And now the last of our 4 awardees will be an award for consumer engagement, and Justin Mendoza will be presenting it. Equal Justice Medicare Expansion.
Hello, advocates. How are we doing? Excellent. Well, it is my absolute pleasure to introduce our Health Advocate of the Year for consumer engagement. My passion is found in seeing consumers and healthcare advocates face unlikely odds, face the biggest challenges that we have in this country to really reshape the healthcare system around us. And the biggest thing that happens with that, the biggest kind of secret sauce that we all know, is truly amplifying and building the consumer voice so that we can win on these insurmountable Herculean tasks that we all take on. That's why I'm incredibly excited to present this year's Health Advocate of the Year Award in consumer engagement to Robyn Merrill of Maine Equal Justice. This year's recipient has been working to drive her state towards better health and healthcare since 2009 with Equal Justice by building campaigns. In her work in campaigns, she's known for listening to consumers and engaging them early on as the core foundation of the work that they do. Robyn has faced adversity with an attitude that one of her colleagues called a why not, we must and we can win attitude. Despite facing a governor who fought hard against expanding Medicaid to the people in her state, she used her abilities to inspire lifelong advocates and brand new grassroots advocates alike to pass Maine's ballot initiative that would ultimately result in the state expanding Medicaid to cover more than 43,000 Mainers. Thank you. Central to Robyn's strategy is building true trust with the consumers who have been let down time after time and seen their hope flicker out with the signing of a pen or the veto of a governor. Now Robyn is taking her energy, her passion, and her network of community leaders to drive progress on dental health, because dental care is health care. Those were Robyn's words. Robyn is humble in her work, giving credit to those voices that she's worked to empower, but her approach, expertise, and success embody the spirit of consumer engagement that we aim to highlight with our award. So please join me in welcoming Robyn Merrill, Executive Director for Maine Equal Justice and our Healthcare Advocate of the Year in Consumer Engagement.
I'll never forget what it felt like to stand with women who just learned that they'd gained health coverage after going without it for so long. It was November 7th, 2017, and Mainers had just supported our ballot initiative to expand Medicaid by nearly 60%. We gathered to watch the election results come in, and these women, who'd become friends, were just declared the winners. This meant that Kathy could now afford to get the oxygen she needed to breathe easily. This meant that Brandy could get the care and treatment she needed to come back from cancer. It meant that Linnea would no longer be forced to choose between going to the doctor and putting food on the table. This win was so deeply personal to these women. Their joy and relief was palpable. I will never forget it. It went beyond what this would mean in their own lives. This meant that their courage and all their tireless efforts had paid off for 70,000 other Mainers like them. All the doors they knocked on, the friends and neighbors they'd spoken with, the stories they shared with the world, stepping into a new and unfamiliar space to advocate for public policy change. This meant that those efforts meant something big, something well beyond them, yet all about them. These women who gained health coverage were part of the healthcare leadership team that was at the core, at the heart of the Mainers for Healthcare ballot campaign. Not only did they dig in and advocate their hearts out to make it possible, they kept other advocates like me connected to what the work is all about. No matter how tired or discouraged we get along the way, we can't give up because people's lives are at stake. We built friendships during this fight. We had to make some hard choices together along the way, and we took a leap of faith together. You know, back when the ACA's future was far from certain, we had to make a choice. We'd collected enough signatures to put expansion on the ballot in one day, the day Trump was elected and vowed to repeal the ACA. Everything was uncertain, and even other healthcare advocates were advising us against moving forward. But this was our only chance to expand coverage, and we were in this fight with people who needed care. We knew Kathy needed care, Brandy needed care, Linnea had waited too long. Tens of thousands of others were waiting, and this was our only path, so it was decided, and we submitted those signatures, and they made our win possible. What I learned: be bold on healthcare, and when you center impacted communities in the change you're trying to make, anything is possible. Also, patience and perseverance. After Mainers enacted a law to expand Medicaid, we weren't done. Our prior Trumpian governor refused to implement the law. But people waiting for health care started a countdown to care, mounting pressure at the legislature and ultimately in the courts. The healthcare leadership team led the way the day we filed the complaint in court. This was not Maine Equal Justice's lawsuit. This was the people's lawsuit. They were the named plaintiffs. They were driving it. They called it our lawsuit because it was. And they won. Big change takes time and commitment. We worked to expand Medicaid in Maine for over 6 years. We were the first to go by ballot, and I am so impressed by all of the brilliant advocacy since then in red states to make this happen for hundreds of thousands of others in this country. And we're not done in Maine. Expansion is but a step on the journey toward healthcare for all. We can only get there if we continue to build power and leadership in communities most impacted by our broken healthcare system. This year, we're working with people without dental coverage to add this benefit to Medicaid in Maine for adults. We're taking steps to resource immigrant communities to lead the charge to ensure access to health care for all people, regardless of immigration status. All people. And we won't stop until we're done. We don't give up. We've proven that. And I know you don't give up either. You have heart, and you're connected to what's truly at stake and why this matters so much: people's lives. I'm inspired by all of you. Thank you all for everything you do every day to advance healthcare justice in this country. Together, we're building a movement to fix this broken healthcare system. Thank you, Families USA.